Hello and welcome to Serotonin Milkshake. Peter here. Hope everybody's doing great this evening. Where your voice matters. So what I wanted to do is share the scar that last Thursday I had a complete and total shoulder replacement on the left, and then the brace that goes with it, and then maybe the story real quick, just to let anyone who might be facing any kind of a replacement surgery such as mine. It took 18 staples. So there's 18 staples right there. And I'll tell you what, it was a big one. It's a big one. I've had surgery 3 times. And basically, this is the most, by far, most painful experience I've ever had. So anybody coming into this type of, any kind of orthopedic surgery, or where they have to have a big surgery, just wanted to calm your mind a little bit about the process. The way I first learned about it was I was driving my car and basically going light to light, and then all of a sudden I had I'll use my right hand obviously for the sampling. I felt this on my steering wheel. There was an involuntary reaction just like that. And I said, oh my gosh. And that was not normal. And so I said to myself, I've got to go check this out, right? Because this is just not normal. So the situation increased over time, decreasing the ability, the motion, the range of motion, and the reaching behind my back, reaching above my head. And basically what had happened was, I have degenerative disc disease, which is a condition that's inherited. So I had to manage this properly. So I wanted to share basically, again, the stitching, the brace, and how it feels, recovery process, and kind of take you through my journey a little bit. Anyway, so that was happening, and basically that happened for a couple of months. And then what started happening also was this range that I couldn't reach anywhere above my head like this. And I was basically just unable to go any further than, right about my ear level here. And then also I could not reach in the back. Now, unfortunately, my right shoulder has similar properties. And I'm really hoping, and at the end of this video, I will explain, what I think, in my personal opinion, is about, facing, this type of surgery. But anyway, so that was happening. So I reached out to, I won't mention any affiliates or names of any, healthcare organization groups, but I'll just use like hospital or, physical therapy place, or, visit with the surgeon. Anyway, it's just, there were so many steps, it's almost impossible to memorize them all, but, or have them memorized. I went to go get it checked out. The first place I got it checked out was my back doctor. He was the wrong person. Unfortunately, I had to go and book an appointment and wait, and then go to that appointment to find out that he doesn't cover, the upper portion of your chest cavity. He's basically just lower back. And I had surgery in 2015 for lower back surgery for, I think it was L3, 4, and 5. Basically, it was shaving the vertebrae off of a nerve that was being, manipulated, and it was just driving me crazy. But anyway, so that was part of this whole degenerative condition. So it kind of, I guess it was just creeping its way up, going up north. And basically the osteoarthritis goes from, shoulder to shoulder. I've got extreme pain. I've got I think it's 7 to 9 trigger points, in the back for fibromyalgia, which is basically, the exact name for, that amount of trigger points that are infecting your back or whatnot. So everything was going on up here. So basically I went and I started with a doctor for the back. And then he said, well, you can't do this because I don't do this portion of the body. So I said, okay, well, please give me, that referral. So I got a referral to go to somebody who finally, can assess my upper torso and what was going on with it. There was, to skip a couple of steps, there was, I've got this memorized. Basically they ask you to, go to physical therapy. They offer you pain medicine, exercises you can do at home. Basically anything to, prevent this type of surgery, because that's the last thing that they want to do. So what had happened was I went to that appointment and basically was ordered an MRI. So I went to get that done. And then I came back and basically I met with the surgeon that would be scheduling my surgery. And basically he came back with the MRI and he said, complete shoulder replacement. And I said, what? And he's like, complete shoulder replacement. And I said, what? And then I wish he had shared, I'm going to give you some opinions of mine too. I wanted to make a video on like bedside manner, for these people. The medical landscape has completely changed, and I wish it could change back a little bit. I think people are less, doctors, professionals at that level are, less inclined to spend more time with you. They're not, their bedside manner is lacking. I think innovation and technology kind of gets in the way between the interpersonal relationship, which I think is still extremely valuable between patient and doctor. Anyway, so he came in, he gave me a little nod, a little smile, but he didn't share the MRI with me, and I wish he had done that. So if you're facing, this type of situation, basically, I would ask, I would say, hey, listen, can you show me that MRI? Because initially, in my previous MRI for my lower back, I actually had to YouTube, the definition of what it was that was going to be, done, or what was done, or excuse me, I actually had access to the film for the MRI, and so I basically had to go in and, read the after visit summary, and I had to read exactly, what it was that was failing in my body. So basically I had to YouTube those terms, and I actually had to read my own MRIs via YouTube and kind of understand my condition via YouTube, which I really don't think is, I really don't think that's the way it should go. I really honestly think that the doctors should be doing their job and, kind of going over everything with you. So anyway, found out that I needed a total shoulder replacement, which is called arthroplasty. And it's basically complete shoulder replacement. There's like 4 levels that you can, take part in. I had to go right to the 4th one. And the reason being was because I'm young enough and I'll say that one more time, young enough to knock on wood or glass, or whatever's available. Here's wood. I got wood. So knocking on that in terms of age and my chronological journey here. They had said, listen, you're healthy enough. That's the reason why we're going to go in and do such an intense procedure on you. So that was the reasoning of why I had to go in for the complete replacement and then actually get the ball and the stem, placed. I believe it's still called a prosthetic still, even though it's internal. So anyway, I'm all set to do this, right? And basically what had happened was I was ordered, to go to all these appointments. And the first one was physical therapy, to find out what the range of motion was. Now, insurance companies are very tight when it comes to giving you these authorizations for physical therapy. So I really only went to like 4 of them. And, they gave me some at-home exercises, and I wasn't able to really, get too far into them, but I did try. And, there was nothing that was going to really help the situation. So anyway, moved on to the other appointments, which were required pre-surgery, which were 2, well, it ended up being 2 visits for an EKG, full physical. And then I ended up having that done twice because I switched doctors in the middle. So I had to redo the entire physical. So I had 2 physicals. And then, of course, I had to go, no, of course not in the past, or what people think is basically, and they never used to do this. I don't know the history. However, I had to go to the dentist. And that was a real hang up because I had to find a dentist. I had to go to the dentist. I had to schedule an appointment time with the dentist. And so many of these appointments in these medical facilities are so far out. Like they don't have any room for you. And I live in the RTP area, which is basically the Research Triangle Park area. And we're, were covered, with two very significant, even three or four very significant universities that are large, and they just pump out medical professionals. That's all they do all day long. So I don't understand, and also the video opportunities that we have to get online to have an appointment as well. I don't understand it. So that's another issue. Maybe somebody can share as to why. Maybe a doctor's watching. Maybe they can chime in and say, "Hey, listen. This is the reason why these appointments aren't able to be made." But anyway, so I had to wait, right? So obviously this is getting worse and worse and worse, and so I had to wait. I finally got a good dentist. And I went in and I had to get a full teeth cleaning, and then I had to come back, for another teeth cleaning. It's like one side and then the other side, and then I was required to have 3 weeks of wait time before the surgeon would do my procedure. So 3 weeks went by after the fourth appointment, okay, which was the last dental appointment, and basically what had happened was I was able to schedule the surgery. Now they have what they call surgeon extenders, professionals that are reach out to all the people that those surgeons are going to operate on, and then they help them along the way with the releases and any information that they might need. So I'm trying to reach back to this particular extender, and she's not available, and it's very difficult, and I was doing things faster than they were in terms of communication, going between offices and getting releases and forms to share the information back and forth, because I was between actually 3 different medical organizations. So they all had to get on point with one situation and one patient. That was me. And I know that they have access to all the other platforms, or the platform, I'm sorry, but the software inside that basically they can switch back and forth from university or healthcare organization, and they can see information, but it is limited information. So at any rate, I called and I said, when can I get this done? Okay, because it'd been 6 months or so. And it had occurred like 8 months prior. So it was just taking a really long time. So I was able to finally get that done. And I finally, all the appointments were met. And I called the extender and I said, let's do this. And they said, okay, the 21st of this month of November. And I said, okay, fine, I'll take it, okay? And basically, that was it. So I basically waited for the couple of weeks that I had to wait, and to basically thinking about the process and saying, the previous surgeries I've had, Peter, you're going to be fine. You're going to wake up. There's going to be nurses around you, and you're going to be, they're going to be looking over you, and you're going to be fine. All right. It's just they're going to walk you right out of the wake up process. But at any rate, it was not like that. It was very from one institution to another. It was very repetitive, almost like they were doing these surgeries all the time, and it was like in and out kind of thing. And you're putting 18 staples in my arm, and then you're telling me go home with a couple aspirin or something. That's not true. They did give me medicine, but that's how I felt. It's how you connect with people. And that's why serotonin is so important, because I really want to get people to connect in here. But at any rate, so I went through, and I talked to a couple of personnel staff at the hospital. A couple of people were nice, but there was also a couple of people that were very aloof. And I'll tell you, it was not cool to hear that, because I was trying to get my direction, going in the right way. And just for example, I met with the anesthesiologist nurse. Well, I had my pre-surgery meeting, okay, and that nurse was going out on leave because she was having a pregnancy. And I said, to myself, in my opinion, I said, really, I care, but I don't care. But because patients really, they don't care. They don't care about what's going on in your personal life. They care about what's going to happen to them, especially something like this. So that didn't need to be said, right? So that nurse wasn't going to be at my surgery. Second, the anesthesiology appointment that followed the pre-surgery appointment. That gentleman came in. I was very impressed. Basically, he, had he spoke very well, and he had information, and he just had a lot of knowledge, a lot of wisdom about going under, and and I, at that point, I was signing my my death certificate or whatever, the waiver, to go under, and if I don't come back, I don't come back. But that's only, again, 1 in 100,000 people. But anyway, that's the stat on that, and I shared that in one of the last videos. So I was not one of those this time, although I've had now 4 surgeries or something like that. But anyway, so onward. He said, the anesthesiologist was like, I don't know if I'm going to be here that day. Mentioned the other nurse, said she's going out on pregnancy, and so I heard that twice, which I didn't need to hear. Again, I don't know if they're just talking to themselves or thinking aloud or whatnot. Again, it's just not the patient's concern. They should just be talking about you strictly. So in the end, I asked him. I said, "Well, I really look forward to being with you and having you behind my head and controlling my process, my anesthesiology, as I go through this process." And he's like, "Well, I probably won't be there that day." I said, "What?" He's like, "Well, somebody from my team is going to be here, but I may or may not be there." So there's 2 people that I met that were supposed to be in the surgery suite that weren't going to be there. So I didn't know who was in the room. I mean, I just wanted to make sure that my surgeon was in the room, that one guy that I said, okay, I feel comfortable with. So, and he was going to be in the room, and that was enough, I guess. So off I go. I went back to kind of a pre-operation waiting room area with a bed in a room, and basically had a very rude nurse come in, and she's just like so it was 8 a.m. in the morning. Another thing that had happened was they had called me last minute. I think I booked the 29th or something like that, and that was actually the date, I believe, but it had changed from something like 4 o'clock to now it was 8 a.m. in the morning with an arrival at 5:30 a.m. So, again, inconveniencing the patient. So I don't know if I don't know about this cancellation policy. Call the customer, see if they want, or customer or patient, and see if they want to take an earlier slot or whatnot. But, I don't know. That helps the doctor. That helps the medical world, when they can maximize, their calendars, to make as much money as they possibly can at the cost of the patient having to move their life around. Anyway, that's just an opinion. That's just my opinion. But so I was waiting in the bed, and basically that was it. And I changed and had a couple of pictures taken. I did a video before I went in, about 20 minutes, and may or may not share that. But off I went, and then gonzo, to kind of into the into the great wide open, but in your head. And so anyway, just that feeling of 2 seconds went by, and then boom, somebody's waking me up again. It was not a supportive group of people. Basically, they were just trying to get me up, get me conscious, and then get me dressed, and then give me my belongings, and kind of showed me the door. And so it was kind of this in and out process. Like they were telling me the surgeon does this 3 to 6 times a week, and so it's no big deal. And well, I'll tell you, man, this is a big deal for somebody who's never had this done. This is a big deal. So I don't really know how to say this, any with any nicer, but please take the operation. I'm not going to say seriously, but know that the patient's facing this for the first time, and even though the surgeon might have done it a million times, it's really just, you have to just be, again, mindful, putting your feet in the person's shoes, doctor to patient, you know, understanding, kind of their fears, their thoughts, their questions. There was like, when I got home, there was about, 50 questions that I had that I never had answered. Okay. So that's all I have as a recommendation. It's just kind of be basically present, and present in the room. Maybe ask some question provoking statements, for the doctor. Make statements that might be thought provoking. They always ask, hey, do you have any questions? But you don't even know what to ask because you don't even know. You don't know what you don't know, right? So anyway, it happened. And I was like, okay, this was the choice I made for my life. I'm waking up and I'm going into the 1 week period of this having been done. And I couldn't wait to get back, to talk about this, because if anybody could, use this video, to just kind of a orange cone, I'm just trying to like orange cone it for people if they go into, any medical hospital now to get any procedure, what to look out for, what not to, what to ask, maybe we can come up with questions on what to ask when you're going through a surgical treatment. Of course, it's all on paper. They give it all to you. They just want you to do all the research. They want you to do all the work. They don't want to spend, very much time with you. And basically they just want to make it feel like, you're just another number, statistic going through the hospital and getting a shoulder replacement. So that was the feeling and the vibe that I got. And to kind of, sugarcoat that on the top, I had 2 parties. One that took me home. The first night was horrific, with the block that was on. That wears away over the course of a few days. And basically what you're left with is this horrific pain. And basically you just need to manage that with meds and ice and basically being quiet. And just not moving that arm at all, and then trying to sleep, and then those are some other areas that we could get into. But anyway, so that happened, and then I was transferred over to another party nurse who basically I spent a couple nights with her. She was awesome. She basically was able to look after me, and then she took off my bandage at the 4-day mark, which was the day that they said to do that. And then I took that off, or we took that off, and extremely helpful. And then I decided to come back to my home, because I wanted to, sleep in my own bed, which in a familiar, the most familiar place for me to, feel comfortable, kind of get everything straight, to be close to the hospital, be close to the pharmacy, be close to the areas, the offices that I needed to be close to in case anything had happened. And I did go to urgent care this morning, and that was another story. Basically, they didn't want to have anything to do with it because I didn't know about the red tape, and I didn't know about the liability issues. That wasn't on my mind. Again, it was my health. I just wanted to look over to make sure that the incision was okay after taking the wrap off. And basically it was, but I had to really push it through. I had to get through one nurse, had to go to another nurse, and then 2 more nurses came in, and then they left. And, and I apologized. I said, listen, this is just a really rough week for me. But I want to know what's going on as far as, basically show me how to put this brace on. If you know how, just tell me if the incision's okay. All right. And I'm going to put a new shirt on, and then I'm just going to go home, and then there was another, medication request. But anyway, so that was it. I mean, it was just a long drawn out process where, it just, if I was managing every step, in my opinion, I probably just would have put a little extra effort in. I would have put a little bit more, mannerism in there, more enlightened conversation with the patient. That's the word I'm looking for. And, you just kind of get brushed off, and, it's like, okay, whatever, who's that? It's like, what's your name again? What's your birthday? And I don't know if other folks are experiencing this too, but just the medical world has just kind of been turned on its head. I don't know what the deal is, but they just don't seem to be as nice as they used to be. They're not like, spending the time that they used to spend with you. They're not asking you as many questions as I would like for them to ask. And it's just, the whole experience is just a little more icy. You're a little bit more on your own, that type of situation. You kind of basically don't feel like you've got enough support. So make sure you've got a lot of support, at home with friends and family. Make sure that you're covered at home, basically even to the point where you're gonna take the caps. Even the caps are too hard to take off of your medicine bottle. So take them off beforehand and then just kind of rest the cap on top of it, get it unlocked and then rest it on top. It is that difficult to actually utilize that hand. Basically, so mine is my left hand. It's not my dominant hand, thank goodness. My right is I'm right-handed, so that's a good thing. However, you'd be amazed at how many, muscle groups you use and how many actions, kind of flow into your other arm, your non-dominant arm. And I'll tell you, I was dropping things. I dropped a vase this morning. I spilt a Red Bull on a bunch of papers in the kitchen. So I was like, how much weight can you put in here? And it was like a coffee cup, I think is what they tell you, but even that's too heavy. And then I came to understand that, the story continues with the fact that I learned that they cut your nerves. Okay, they cut your nerves. Okay, and that to me was shocking. Apparently they do that just to get down to the wound, and it's just easier, and without, I don't know, separating it usually with a clasp. I would say that might be a better choice, but I don't know. I'm not a doctor, so not a surgeon. Anyway, so that really created probably half the pain that the entire surgery had to offer. Extreme pain, basically around internally, kind of around the wound area. You get you get lots of bruising here. It's swollen. You need to put ice packs on. Make sure you only do them for 20 minutes at a time, because it can hurt. You can hurt yourself if you ice yourself too long. And basically, so I was doing that. And then rest is the most important thing one can do. And that's what I'm finding. So because if I pick up things, again, that nerve cut just blew my mind. I couldn't believe it. So there was, I was trying to use my left hand, and any movement that I had, or if it was significant in any way, would just feel awful. Like, from my elbow down to my wrist, it was just awful pain. And that was just lack of nerves. The nerves that were cut, slashed, so to speak. And I had no idea that they did that. But I had an insider kind of tell me that, and I just was like, that really bugged me and stuck with me over the last few days. And I could feel that as a direct issue and problem, and in the pain realm of this process. So basically, I'm on my, I'm just shy of a week. It was Tuesday when the operation happened. So basically right at the week mark. And so, I just wanted to come in again and just share what happened and why it happened. Again, unfortunately, it's degenerative disc for me, and I have that in my family. So I'm gonna have to, address deteriorating bones, muscle tissue, all kinds of stuff like that, all orthopedic in nature. And so, it is what it is. So, we power on, we have hope for tomorrow. We believe in, the future. We're happy for what we have. We're happy for, I'm happy and grateful that this is behind me, although it's, the pain is extremely, just horrible, there's no other way for it, basically. So you really have to just take care of it. And so I'm in my sling, okay, and I got the Cadillac of slings. I'll just kind of show it to you. It takes like 8 people to put it together. It's got like 49 pieces of Velcro that goes around it. And so, getting in and out of that, taking a shower, changing your clothes, you have to make an appointment with somebody to get, to help you put it back on. So I don't know. If you have any thoughts or suggestions on that, it's that is a Dawn Joy or whatever it is. I think it's yep, Dawn Joy, that's the brand. Again, another product that had to be searched all over the country and took forever to get here. And then finally, after like 3 months of it finally getting here, it was out of stock forever. And then that finally got here, and I was able to, I left it in the bag, until the procedure. I just didn't want to mess with it. But it also has a little red ball that you can squeeze for, to keep the mobility going. So I would recommend that. So in a nutshell, and why I made this video so soon is I wanted to wait, but I just also wanted to share. The share was became greater than the patience to wait and do this when I'm fully ready. But we'll have lots of videos, which will be great. So if anybody has any surgical, just general surgical, issues or concerns that they have, and maybe this video might be able to help, kind of ease your pain, I would just recommend having people that are really close to you, in that initial, when you come out of the anesthesia and you're basically going home, have somebody that's really, really, really understands you. That's important, and really cares for you. And they're going to see you at your absolute worst, probably. And then, it's hard to, somebody said it's hard to talk through the pain, and it's absolutely hard to talk through the pain. I've got parents that are in their 80s, and I was at their place the first night, and that's absolutely no burden whatsoever to put on your, people like that. They had challenges in all kinds of ways in terms of trying to help. So I was going to stay there for 2 nights. I only stayed there for 1 night, and then I called my other friend, who basically helped me, came and got me, and basically I stayed with her for a couple of nights, and basically, she continued the process. Fortunately, she's a nurse, and so basically it was just, what better place to be. So I was able to do that. Again, I just won't repeat the story, but just make sure you've got people that really care about you around, and that are going to really, put your best interests at heart, understand what's going on, the severity of what you had just gone through, and kind of the shock factor, and having that wear off, and having somebody to be there with you. I honestly, I wouldn't pick up anything heavier than a tag, a shirt tag on that operated arm. Just kidding. You can go a little bit heavier. I don't know. Maybe the remote for your TV. I don't know. Maybe that's probably the best thing to put on. Kind of like duct tape that to your arm. So I'm on a journey for 6 weeks. Initially in the sling, 24/7, except for showers. And changing, my clothes. So that is the course. And so I'll be able to, post a lot of videos, which will be really fun. And I'll, deep dive on topics and find, content that's going to be really meaningful. Again, steeped in joy and happiness. This show is going to be positive. I met my neighbor today. She had all kinds of things to say. I invited her to come in and interview and talk about, any important subject matter that she has. And so, again, the channel, the summary, remains consistent in that's going to be joy and happiness, derived from, really meaningful content. That's what it is, and that's what we're here for. So thank you so much. Please like, subscribe, and share if you are able to obtain any kind of insight or help from this video. Again, and then please tune in for next time. Can't wait to have you on the channel again. Thank you so much.